I'd like to start with a story about a child that I took care of as a pediatric resident at the city's safety net hospital, Boston Medical Center. I first met Ethan as a pediatric intern, a first-year doctor, in the neonatal intensive care unit, where he was recovering from the effects of prenatal exposure to opioids. He spent about 6 to 8 weeks in that NICU and took his time to figure out all of the issues that normal babies just do at birth, figuring out how to eat, figuring out how to gain weight, figuring out how to self-console. And even when he figured all that stuff out and he was a thriving infant, he lingered in the NICU. And that was because Ethan was a product of the foster care system. He was born an orphan. And he eventually found placement in a foster care home, and I was lucky and fortunate enough to care for him as his pediatrician in the outpatient clinic. But over the 3 years that I cared for Ethan, I watched him deal with blow after blow, whether it was multiple asthma attacks, a bad bout of the flu, and more seriously, just missing his developmental milestones, not walking or talking when he was supposed to. And what made that event even more frustrating is I was also a doctor at Boston Children's Hospital, which is literally the leading hospital in the entire world and cares for a much different patient population, private insured, usually more well off. And what frustrated me about this experience is that children presenting with the same problems to a hospital that was literally 2 miles away, I would walk between them, would do much better. And it was really the desire to know the answer to why you could have such different outcomes in social close proximity that led me to this stage today. As I started to explore this question, I pulled some public data, and I was shocked to learn that within the city that I call home and have been living in for the last 20 years, there is a dramatic and shocking difference in income of a median household. I've colored here in blue by neighborhood median household income, where dark blue tends to be wealthier households, and I hope you can appreciate that there's a lot more dark blue around Boston Children's Hospital than Boston Medical Center. What left me speechless, though, was when we looked at the life expectancy from 2 neighborhoods served by these hospitals, there was a difference in 25 years of life expectancy in the poorest neighborhoods of one of the most developed cities in the world. That's an entire generation lost, and less than 1.5 miles apart. And Boston's actually a really interesting city to run this example in, because we have more hospital beds and more healthcare providers per capita than anywhere else in the country. And we're actually, as a city, have a pretty low violent crime rate. So what is it that is driving this generation lost? I think, and the field of medicine has come to believe, that the social and environmental factors that a child is exposed to early in life and as they grow up and develop influences their health and morbidity long term. The field has collectively called these the social determinants of health, which is a term you may be aware of. And thanks to the research and advocacy of many, including our former Surgeon General, Vivek Murthy, we are starting to understand how individual aspects of the social determinants of health influence our biology. We know from his work that social isolation is actually just as lethal and impactful on your health than smoking a pack and a half of cigarettes a day. It's led me to wonder if just how we have these surgeon generals on the sides of cigarette cartons, we should be putting them on the devices and the technology that drives us further apart instead of bringing us together. And why I think this is an urgent public health crisis is I think our nation's most valuable asset, the future generation, is suffering as a result of environments that are setting them up for failure. If we look at mental health diagnoses in college students, over the 10-year period between 2008 and 2018, there was a doubling in the prevalence of depression and anxiety in our college youth. This is actually an old graph, and recent data that I pulled just for this talk in 2025 that showed up to 45% of incoming freshmen across the country report suffering from or having suffered from depression in the last 2 years. So these are numbing numbers, a 25-year difference in life expectancy in the same developed city. Nearly half of our college youth struggling. How do we respond to a crisis of this magnitude? You know, I've heard a lot of people say that, well, social problems need social fixes and political will and policy, and I won't deny that. We need to make our communities more resilient. We need to create better social safety nets, but we need to figure out innovative and new ways to solve these problems. When I think about the graph that I just showed you on the last page, I'm reminded of a graph that led me to become a scientist and pursue an MD PhD in the first place. I remember sitting in a class and seeing this curve of the HIV mortality rate in the United States across time, and feeling like I imagine the practitioners and the doctors in the communities that were sitting in the midst of the HIV/AIDS pandemic in 1990 must have felt how we feel today in the midst of all of these environmental issues that are setting us up for failure. In 1995, the first highly active antiretroviral therapy was deployed for patient use. And look at its impact on mortality curves. The right scientific innovation, the right tool, leveraged with public and political will, can have tremendous disruptive impact. And this is literally what I think the power of science can have and how we need to leverage science to address this problem. Well, how do we do that in a problem that's so complex and so thorny and so many issues around sort of social environments and these social determinants of health? I think it's going to require cross-silo collaboration, having people that don't talk to each other coming together to talk to each other. It's why I came to MIT, even though I'm based at Harvard Medical School and have benefited so much from this community. We need the neuroscientists, the experts in sort of brain chemistry and brain biology, talking to epigeneticists that we heard about. Epigeneticists think about how experience shapes the genes that we inherit from our family. We need them to talk to exposure scientists who are thinking about how to model these complex exposures. And finally, the public health and physicians who know what is important to model. If you'll humor me, I'd love to walk you through what this could look like. And we've been a bit doom and gloom, so I want to sort of brighten up the mood a little bit. Let's talk about something positive. We know, and we almost take as self-evident, that positive stimulating environments are good for our children. We know that if their brains are stimulated, that they're going to respond with better cognitive sort of potential and cognitive development. Studies as old as, dating back to the 1980s show us simply that regardless of your background, if you are exposed to more words, you will have better language development. We also know at the other end of the lifespan that individuals and elderly patients that stay more cognitively active and stay cognitively enriched can stave off the development of Alzheimer's disease by more than a decade and reduce their overall risk of ever developing the disease by more than half. We kind of take these as self-evident, though, that a good environment has good effect. But actually, if you think about that, under the hood, there are immense changes that are happening in our brain and body to encode that environment into positive or negative outcomes. So how do we model this? Well, thankfully, we can work in the lab and use lab animals, mice, which also respond to environmental enrichment or cognitive stimulation. We know from decades of research by many, many people that enriched mice live longer, perform cognitively better on behavioral tests, and are less likely to develop disease than challenged counterparts that are not enriched. So we leverage this model and an epigenetic framework to understand how the genes in the brain are turned on and off after enrichment. And when we did that, we found massive gene opening in the brains of enriched mice compared to their control lab mates. And then when we further dissected and looked at what was changed in those open regions, we were actually able to identify a factor, a protein called MEF2, that was actually binding to those regions of open genes in the enriched mice and turning on the expression of those genes to enable function. So now we've taken something as complex as an enriched environment and decoded it into a molecular process. Is this responsible for having the benefit of the enriched environment? To do that, we took enriched mice and we blocked the expression of this protein. So these are mice that are enriched but no longer are able to express this protein that I told you about. When we did that, we found that the loss of this protein led to impediments in cognitive function, showing that we can take the black box and the self-evident notion that good environments have good outcomes and distill them into molecular processes that are really important for encoding that environment into function. And why I think this is so exciting? Because we now have a potential biomarker. We have preliminary data that suggests that individuals or humans that have higher MEF2 activity perform cognitively better on tests. And we can leverage this into new therapeutics. We can try to activate this, and we are working with collaborators to do screens to activate this protein and see if it promotes cognitive resilience and cognitive health. So right now, this is a black box. We know the social determinants of health impact the top 10 causes of mortality. You're 30 times more likely to commit suicide if you've been exposed to chronic adversity in childhood, as one example. But what I would argue is we can turn that into a solvable problem. We can understand what's occurring in the brain using an epigenetic and molecular framework, and armed with that framework, find diagnostic and therapeutic biomarkers that then could be leveraged to help children and adults that are suffering from the impacts of the social determinants of health. And so we can take that curve and bend it with the right scientific innovation. I'd like to end by coming back to where I started. Ethan would be 12 today. I think it's been 12 years since I started training as a physician. And I actually lost touch with Ethan when he was 3 because I chose to subspecialize and take care of infants, which I believe are the most vulnerable sort of unit in humanity. And I often find myself thinking about him and hoping that he found a path to become resilient and have a productive childhood and reach his full potential. But I don't want to wait and hope for future generations and children and not mobilize sort of the right scientific solutions to address the problem today. I think we have the tools. It's just, are we going to invest as a society and take the walk? Thank you.